In health news, the FDA has approved a new heart failure medicine to reduce the risk of cardiovascular disease. It's called Entresto. Dr. Peter Carson, leading heart failure researcher at the Washington Veterans Administration Medical Center, is here to tell us all about that. I did get this correct? Your description?
That's correct.
Okay, absolutely. So I always make sure I introduce my guest the correct way. Tell us first, for those who don't know, what is heart failure?
Heart failure is an inability of the heart to be able to supply the needs of the body in terms of blood flow.
Okay, that's pretty simple. And how many in the U.S. are affected by this?
Over 5 million people.
Really, every year?
Every year.
Wow. So this is pretty substantial.
Yes, big problem.
We don't hear a lot about this. The quality of life of those people who are affected. How does this affect your life when you are having the lack of blood going to the heart?
Well, heart failure with a weakened heart, which is what we're talking about this morning, usually produces symptoms of congestion in patients. So they are short of breath with activity, and they also experience tiredness or fatigue with activity. With mild heart failure, this is with some activity, but with more advanced heart failure, these symptoms can even be present at rest.
Okay, so again, this is something we should make sure people understand. Heart failure, you can live with heart failure. It doesn't mean that you've died, but obviously it can turn into a fatal condition.
Well, mortality is increased,
yeah,
no question, but it is a chronic progressive disease that very much affects the quality of life that patients experience.
Okay, so that's in the background. Tell us about Entresto. What's obviously got to be very exciting about this, but why the FDA approved this medicine over some others that may have been presented?
Well, this medication was studied in a large clinical trial in which it was added to the customary therapies that patients receive with heart failure, which have been quite successful over the last 25 years. These block some compensatory mechanisms that the body produces when the heart is weakened. And this trial showed that there was marked improvement in outcomes in virtually all of those measured. It was a very strong result, and the trial actually had to be stopped early. These benefits were present in all the subgroups of patients that were involved in the trial, and so this is the kind of result that makes us all very excited.
Sure. Okay. So so those who have heart failure, when can they get a hold of this drug, this medicine? When is it available, and how soon might those affected see some results?
Well, what we saw in the clinical trial was that patients had an improvement in their quality of life. They were hospitalized less often, and they lived longer. And these are the things that are important to patients. These effects were present quite early in the treatment with the agent, suggesting that the progression of heart failure was being impacted materially in a way that we've not been able to do before.
Okay. Is there a website or a place where people can read more about this information and obviously talk to their doctors?
If you Google Entresto, a number of websites will come up. Entresto.com is one of them.
Okay, great. Dr. Peter Carson, thanks again for the information. This is really fascinating stuff.
Okay,
Thank you so much. We appreciate it. Okay.